As a nurse practitioner, I want my patients to feel empowered and know they can come to me with any question they have about their treatment options. I've thought of a few questions that a lot of patients tend to ask me about ports and wanted to go over them with you today. One of the most common questions I'm asked is, will the port stay in me forever once it's placed inside me? The answer is no. It truly depends on how long your physician has decided you need to receive therapy. Sometimes ports stay in for a few months, sometimes they stay in for a few years. It really depends on what you and your provider have decided as the most appropriate treatment options for you. Another common question I'm asked is, will my diet change because I've had a port placed? The answer is no. Your diet will not change just because you had a port placed. A lot of patients ask me what they should wear whenever they're having the port placed, as well as what they should wear when they go in for their infusion. On the day your port is to be placed, you'll have a pre-procedure checklist that'll explain to you what you should wear on the day of the procedure. Oftentimes, you'll be placed in a surgical gown, so it really doesn't matter what you're wearing that day. However, I recommend loose-fitting clothing so that afterwards your clothing won't rub against your new port site. Another question I'm often asked is, what should I wear the day of my IV therapy? The answer is some loose-fitting clothing. You'll want to be comfortable during your IV infusion. It's nice for you to wear a button-down shirt so that whoever is accessing your port doesn't have a challenging time moving clothing around to get to your port. Many patients ask me if there are any physical restrictions once a port's been implanted. After the small incision has healed, you should be able to return to your daily life. Most physical activities are fine, but it's recommended you consult your physician about specific activities. Patients will ask me if there are any type of aftercare they need to do at the port site once it's healed. While there's no special aftercare needed, monitor your port site regularly, and if you have questions or suspect a problem, contact your physician. Patients will also ask me, is it okay to fly? And will this cause problems when going through TSA at the airport? No, it's not going to cause any problems. It's always advised to let the TSA agent know if you have some type of implanted medical device, but it will not interfere with flying. Remember, you can impact the way your treatment is delivered. Make sure you're involved in your care. Ask your doctors or your nurses questions about vascular access devices or different treatment options. Asking questions is a good thing, and we want our patients to be involved in their care with us, making decisions together. Thank you so much, and good luck.